You know that feeling. You walk into the pharmacy, maybe hand over your script, wait a bit, get your medicine. Seems, well, pretty simple, right?
Just a quick transaction.
But what if I told you there's this whole incredibly detailed world behind that counter? Strict standards, practices, rules.
That is exactly what we're pulling back the curtain on today. We're doing a deep dive into what good pharmacy practice actually means. And yeah, it's way more than just counting pills.
And we're using a fascinating guide for this. It's a national guideline from Sri Lanka's National Medicine Regulatory Authority, the NMRA. This isn't just like helpful advice. It's a blueprint for the standards they expect.
And our mission here is to really unpack it for you because it shows this huge shift, really, moving away from just thinking about the product.
The medicine itself.
Exactly, towards focusing on the patient. The goal is something they call pharmaceutical care, which means basically it's all about your health outcomes, not just the sale.
Okay, let's really get into that shift. The guideline kicks off by setting this foundation, this different way of thinking.
It does, yeah, very explicitly, moving from product management to genuinely caring for the patient. Pharmaceutical care, that's the defined goal. It means a pharmacist isn't just a vendor. They're actively involved in making sure that medicine works best for you.
So if the focus is on me, the patient, where does that even begin for pharmacy? Like the physical place?
Well, it starts before you even get inside, actually. The guideline says the pharmacy has to be easy to spot, clearly marked, and interestingly, accessible for differently abled people.
That detail alone speaks volumes about being patient-oriented, right? Thinking of everyone.
Absolutely. And inside, it's not just about shelves. The pharmacy part has to be separate from, say, selling cosmetics or whatever else might be going on. Keep the medicine safe, reduce errors.
Makes sense.
And the pharmacist needs to be, visible, easy for you to walk up to and ask something.
And the general vibe, the environment.
Yeah. Clean, obviously. Pest-free, comfortable for you and the staff. And here's a specific point. Constant power supply. Super important, especially for the fridges holding certain medicines.
The validated fridges.
Exactly. They even suggest having drinking water available. Again, little things for patient comfort.
Those details matter. Now, you mentioned talking to the pharmacist. Is there anything specific about, like, where that happens? Patient counseling?
Okay, this is where it gets really interesting, and it really highlights that shift we talked about. The guideline mandates a separate area. A counseling area.
Wait, hang on. A separate room or enclosure, not just leaning over the counter.
That's right, a private space.
Yeah.
So you can talk confidentially, without everyone hearing. Ideally, it should have reference materials to books, maybe internet access, for those deeper chats about your health.
Wow, that definitely elevates it. It's like a mini consultation space.
It's a physical sign of that commitment to pharmaceutical care.
Okay. What if they actually make some medicines there? Compounding.
Yes, extemporaneous preparations. For that, there needs to be a proper designated area, enough space, all the right equipment, and crucially, it needs to be calibrated.
Calibrated. Precision matters. And storage generally sounds like a huge deal.
Oh, absolutely vital.
Yeah.
Shelves need to be neat, protect from dust, moisture, light. And the big one, storing medicines at the right temperature. Prescription meds kept away from customer access.
Right.
And here's another one of those rigorous details. They have to monitor the temperature in storage areas and keep daily records.
Daily records.
For 2 full years.
2 years. Okay, that really underlines how critical storage conditions are for medicine quality.
It really does. And security. Certain drugs, the guideline calls them Schedule 111 drugs, need special handling.
Meaning?
Lock and key. Simple as that. Stored securely.
Got it. And what about stuff nearing expiry? Or already expired? Can't have that getting mixed up.
No way. Near expiry items have to be stored separately, ready for disposal or return. And expired drugs, totally separate. Locked shelf, clearly labeled. Expired goods, not for sale. Very strict about that.
Good. Very clear separation. So the space is meticulous. What about specific equipment, beyond the obvious, like shelves and fridges?
Well, the validated fridge, like we said.
Yeah.
Reference materials, leaflets for patients. And remember that detail. A weight and height scale is required.
A scale in a pharmacy. That feels unexpected. Why?
And that's where you really see
Yeah.
the patient-oriented thing again. It's not just dispensing, it's assessing you. Your weight is crucial for dosing lots of meds, right? Especially kids. Or for calculating BMI, which relates to other health stuff.
Okay. It's a clinical tool, not just random.
Exactly. The guideline also prefers pharmacies use computers for inventory, invoicing, getting expiry warnings automatically, and importantly, for keeping your medication records archived.
Archiving records. ties right back to knowing the patient history. Okay, let's switch to the people, the pharmacy team. Who's in charge?
There's a key role, the responsible pharmacist. They have the final say, the ultimate responsibility for all the professional stuff happening there.
The buck stops with them?
Pretty much.
Yeah.
And everyone else working there?
Yeah, the assistants, technicians.
All staff, even new ones, need documented training. They have to follow clear, standard operating procedures, SOPs. Basically, step-by-step guides for doing things consistently.
Audit, procedures.
Everyone needs clear roles, wear neat coats or aprons, and pharmacists must wear a badge. Name and pharmacist clearly visible.
Like you see in hospitals, professional identification.
Exactly.
Yeah.
And the pharmacy itself has to display its licenses, registration certificates prominently where you can see them.
Builds trust.
And staff health is mentioned too. Immunizations, regular medical checks.
Okay, so that brings us to what the pharmacist actually needs to be able to do, their competencies. This sounds like it goes way beyond just finding the right box.
Oh, definitely. This is the real core of that patient focus. The list is pretty significant. They need to assess prescriptions, not just read them.
Assess, meaning?
Meaning check everything. Advise on both OTC stuff and prescribed meds. And critically, check for interactions. Drug, food.
Interactions are always a worry. But this guideline seems to go further.
It does. They have to check for interactions not just with what you're taking now prescribed OTC,
Yeah.
but also with meds you've taken in the past, if that's documented.
Wow, cross-referencing with history.
And checking for contraindications based on your age, gender, other conditions you have. And checking your history for any signs of, like, overuse or misuse.
So from one prescription, they're supposed to mentally or digitally run it against your whole profile. That's a serious clinical review.
That's the standard for pharmaceutical care. If they see a problem or can't read the writing.
Happens all the time.
Right. They must contact the prescriber. And if they sort something out over the phone, say a dose change, it has to be written down on the original prescription. Dated, timed, signed, or stamped by the pharmacist.
Accountability, a clear trail. Okay, so after all that checking,
That's
finally dispensing the medicine.
Yes. And the guideline says the responsible pharmacist has to personally do the final check and hand it over. And this is when the counseling happens.
Right then and there, ideally in that private area we talked about.
That's the ideal, yes. Proper packing is vital. 2 cold packs if needed for refrigerated items during transport. And the labeling is super detailed.
Like what?
Your name, obviously.
Yeah.
Full medicine details if it's repacked. Clear instructions, dose, how often, how long. Date dispensed. Storage info. Pharmacy contact details. And specific warnings. External use only. Shake well,
All the essentials.
And, crucially, verbal instructions too. Tailored to you. Your language, your level of understanding.
Tailoring it, that's key for making sure people actually follow the instructions.
Absolutely. What about when they make something themselves, like a cream or mixture?
Right, the compounding.
Very strict rules there, too. Documented SOPs for every single step. Recording batch numbers of all the ingredients. Using proper medicinal quality ingredients. Working in a clean space with calibrated equipment. Proper containers, unique labels, detailed records.
Total quality control and traceability. Makes sense.
Exactly. And woven through all of this is providing information, helping you make informed choices by using your meds right, about self-care.
So being proactive with information.
Yes. And if the pharmacist has any doubts about your condition, the treatment they must tell you to see a prescriber.
So knowing their limits too.
Crucial. And they should offer that chance for a personal chat. Make sure you know that counseling is available. Providing info, oral and written, maybe in local languages, helps you understand your illness and meds better. It all aims to improve compliance.
Right, making sure you actually take the medicine correctly. How does the counseling session itself help with that?
The pharmacist has to make time for it. They need to explain how to take it, how long for, when, what foods or activities to avoid, potential side effects, what to expect, how to handle them, what if you miss a dose, other precautions.
What's to cover?
Yeah, they need to use discretion about sensitive illness details, of course. That private counseling area is best. And here's a key technique, asking you to explain it back.
The teach-back method.
Exactly, just to check you've really got it. It's simple but powerful for compliance. They should even have a list of local doctors or clinics handy as a resource.
Okay, so the responsibility doesn't end when you walk out the door. Does it extend to ongoing care?
Absolutely. This is another big piece of the patient-oriented puzzle. Ongoing care. Medication records are vital. Tracking your history, ideally for the last year or more.
What goes in that record?
Not just the meds dispensed. Allergies, any adverse reactions you've had and how they were dealt with, dependence issues, lifestyle stuff like alcohol or tobacco use, any problems you've had taking meds before, past advice given. It's comprehensive.
And private, presumably?
Oh, absolutely paramount. Confidentiality is stressed. Only shared with other healthcare professionals if you request it, or if it's clearly in your best interest.
That history sounds like a powerful tool.
It directly supports the next bit, patient follow-up. This is seen as essential, especially if you have a chronic condition.
Follow-up, you mean the pharmacy calls you?
Ideally, yes. Pharmacists should track your meds, keep your history updated, and actually conduct follow-up calls, or maybe short meetings.
Really? What would they ask?
Check in on how you're doing. How's the medication working? Any side effects? Are you taking the right dose at the right times? Missed any doses? They need to figure out why someone might not be taking it correctly, non-compliance, and offer more counseling.
Find the root cause of non-compliance.
Yes, and this is crucial. Updating your prescriber, telling the doctor about any adverse reactions or ongoing non-compliance.
So they're closing the loop, communicating back to the doctor. That's a huge role.
It makes them a vital link in your care team. It's not just dispensing anymore.
Okay, what about the pharmacy's role in the wider community, public health?
The guidelines push for that too, promoting healthy living, self-care, specifically warning against drug misuse and abuse. Maybe participating in health campaigns, posters, leaflets.
And watching out for safety issues.
That's pharmacovigilance. The pharmacist needs to be alert for side effects, ADRs, things they see or things you mention. They record them, advise you, and must report them to the NMRA, the regulatory authority.
So they're like frontline reporters for drug safety.
In a way, yes, contributing to that national picture. And finally, it stresses their professional role, working with others.
Collaborating.
Exactly. Staying updated themselves, having excellent communication skills to work closely with doctors, nurses, other healthcare providers, sharing knowledge back and forth, maintaining good professional relationships.
That teamwork sounds essential.
It is. And think about this. If they spot a potential issue on your script, maybe the dose looks off, or there's an interaction risk they see, they don't just reject it.
What do they do?
They double check, maybe figure out an alternative. Then they contact the prescriber directly without causing you unnecessary alarm, handling it professionally, discreetly. They're even encouraged to organize meetings for local healthcare pros to discuss patient care.
That paints a picture of the pharmacist as a real clinical partner, integrated into the whole healthcare system, far beyond just handing out drugs.
It completely reframes it, doesn't it? From the sort of retail function to a vital healthcare service, involved in clinical review, counseling, monitoring, collaboration. It's complex.
So looking back at this whole guideline from Sri Lanka, good pharmacy practice is, well, it's incredibly deep. It's everything from the building being accessible to 2 years of temperature logs, to staff training on communication skills, to having policies for everything, rigorous prescription checks against your history, a private room for talks, follow-up calls.
Reporting side effects nationally, coordinating with your doctor.
Yeah. Every single detail, from the physical layout to that follow-up call, is aimed at one thing, really.
High standards, quality assurance, and ultimately, your well-being. Through that comprehensive pharmaceutical care.
It's a universal way from just, picking up a bottle of pills, like we said at the start. This deep dive shows this complex, safety-focused, patient-centered hub operating right there in your community.
And knowing all of that. How much training, how much responsibility, the standards they're held to, all for your benefit.
It leads to a final thought for you. How might you partner more actively with your pharmacist on your health journey now that you know the depth of expertise and care they're actually equipped and expected to provide?